Chronic traumatic encephalopathy CTE is an neurological dysfunctional disorder Look at this picture shows that brain imaging, normal and CTE brain. CT findings and MRI rule out other conditions. Then PET scan identify tau protein buildup in the brain. Look at this. A detail going on. Introduction. Chronic traumatic encephalopathy is a progressive neurodegenerative disorder associated with repetitive head trauma. It primarily affects individuals involved in contact sports, military services, and occupations with a high risk of head injuries. The condition leads to behavioral, cognitive, and motor impairment, which worsen over time. Definition. Chronic traumatic encephalopathy CTE is a degenerative brain condition linked to repeated head injuries, often found in athletes, military veterans, and others exposed to repeated brain trauma. Symptoms may include memory loss, mood changes, and cognitive impairments, and developing years after the initial trauma. Etymology. The term chronic traumatic encephalopathy comes from Greek origins. Encephalo meaning brain and pathy meaning disease, while chronic refers to its long term nature and traumatic highlights its associated with repeated head injuries. The conditions was first described in 1928 by Dr. Harrison Martland as Pouch drug syndrome in boxers before evolving into the modern understanding of CTE. Types. While there are no formally recognized types of CTE, researchers classify the condition based on clinical presentations. One behavioral mood variant associated with aggression, depression, paranoia, and mood swings. 2. Cognitive variant characterized by memory loss, impaired judgment, and executive function. 3. Mixed variance involves both behavioral and cognitive symptoms. 4. Late stage CTE leads to severe dementia, motor dysfunction, and Parkinson symptoms. Causes: CT is primarily caused by repetitive head trauma, including concussions and subconcussive hits. The repeated injuries lead to 1. Chronic neuroinflammation, 2. Toe protein accumulation, 3. Neural death and brain shrinkage, 4. Common causes include 1. Contact sports, football, boxing, rugby, hockey, etc. 2. Military combat, blast injuries, head trauma. 3. Repeated falls or accidents. 4. Domestic violence or physical abuse. Risk factors. Severe factors include the risk of developing CTE. 1. Repetitive head injuries. More frequent head trauma raise the risk. 2. Age at first exposure. Early exposure to head injury, example childhood football, may increase susceptibility. 3. Duration of exposure. Longer participation in high impact activities, increased risk. 4. Lack of protective measures. Absence of helmets or improper safety protocols can worsen outcomes. 5. Genetic predisposition. Some individuals may be more vulnerable due to genetic factors. Complications. If left untreated, CTE can lead to severe complications such as 1. Progressive cognitive decline and dementia. 2. Severe mood disorders including depression and anxiety. 3. Suicidal thoughts and behaviors. 4. Increased risk of substance abuse. 5. Parkinsonism and motor dysfunction. Pathophysiology. Pathophysiology of chronic traumatic encephalopathy, step by step process. CTE develops over years or decades following repeated head trauma. The step by step pathophysiological process involves neuronal damage, protein accumulation, and progressive brain degeneration. Step 1. Repetitive head trauma, primary injury. Step 2. Disruption of blood-brain barrier, neuroinflammation. Step 3. Toe protein misfolding and accumulation. Step 4. Neuronal dysfunction and cell death. Toe accumulation leads to synaptic loss and impaired neurotransmission. Neurons in these frontal and temporal lobes, amygdala and hippocampus begins to die. This results in cognitive decline, emotional instability and motor impairment. Step 5, brain atrophy and structural changes. Progressive neuronal loss leads to cortical thinning and brain shrinkage. Common structural changes include enlargement of ventricles due to loss of brain tissue, hippocampal atrophy leading to memory deficits, amygdala degeneration causing mood and behavior changes, damage to substantia nigra resulting in Parkinsonian symptoms. Step 6, advanced neurodegeneration and symptom progression. Pathology spreads executive function, speech, motor control, and personality are severely affected. Patients enter a late stage CTE presenting with dementia, severe depression and aggression, Parkinsonian symptoms, immobility and total dependence on caregivers. Signs and symptoms. CTE symptoms appear gradually and worsen over time. They can be categorized into early stage and late stage symptoms. Early stage symptoms: 1. Impulsivity and aggression. 2. Mood swing and depression. 3. Anxiety and paranoia. 4. Short-term memory loss. Late stage symptoms: 1. Severe cognitive decline. 2. Difficulty with speech, aphasia. 3. Tremors and motor dysfunction. 4. Dementia and Parkinsonian link symptoms. Diagnosis. Currently, CTE can only be definitively diagnosed post-mortem via brain tissue examinations. However, clinical assessment methods include: 1. Patient history and symptom assessment, history of repetitive head injuries, evaluation of behavioral and cognitive changes. 2. Neuroimaging techniques, MRI and CT scan, rule out other conditions, stroke, trauma, etc. PET scans identify tau protein buildup in the brain. Three, neuropsychological testing evaluates cognitive function, memory and decision making abilities. Nursing diagnosis. Common nursing diagnosis for CTE patients. 1. Chronic confusion related to neurodegeneration. 2. Risk for injury due to impaired cognitive function. 3. Disturbed thought processes related to progressive dementia. 4. Impaired social interaction due to mood and personality changes. 5. Self-care deficit due to progressive motor dysfunction. Medical management. Medications for symptom control. 1. Antidepressants, SSRIs for depression. 2. Mood stabilizers for aggression and impulsivity. 3. Choline stressors inhibitors for memory loss. 4. Anti-anxiety medications. Nursing management. 1. Cognitive support. Provide memory aids and structured routines. 2. Safety interventions, fall prevention strategies. 3. Psychosocial support, counseling, group therapy, family education. 4. Nutritional support, balanced diet to promote brain health. 5. Pain and mobility management, physical therapy, muscle relaxants. Treatment options. Currently, there is no cure for CT, but treatment focus on symptom management. 1. Medications to control mood, cognitive and motor symptoms. 2. Physical therapy to maintain motor function and prevent muscle stiffness. 3. Occupational therapy helps patients adapt to daily tasks. 4. Cognitive behavioral therapy helps manage mood and impulsivity. 5. Lifestyle modifications, regular exercise, healthy diet and sleep hygiene. Psychosocial medicine. 1. Cognitive rehabilitation therapy, CRT, improves memory and problem solving skills. 2. Family counseling and support groups helps caregivers cope with behavioral changes. 3. Mindfulness and stress management reduces anxiety and emotional distress. 4. Social engagement programs prevents isolation and improves emotional well-being. 5. Substance abuse counseling helps prevent self-medication and addiction. Prevention. Preventing CTE requires reducing exposure to head trauma through 1. Use of protective gear, helmets in sports and military settings. 2. Improved safety protocols, rule changes in contact sports to minimize head impacts. Thirdly, education and awareness, training athletes, coach and military personnel on concussion risk. For early concussion management, proper recovery time before returning to activities. 5. Regular neurological evaluation, routine brain health checkups for high risk individuals. In conclusion, chronic traumatic encephalopathy is a serious neurodegenerative disorder resulting from repetitive head trauma through no cure exists. Early detection, medical management and preventive strategies can help mitigate its impact. Raising awareness and implementing safety measures in high risk activities are crucial in reducing CTE cases. Ongoing research aims to develop better diagnostic tools and treatment options to improve patient outcomes. Thank you. Have a nice day.